Welcome everyone to the latest webinar from Cosmetic Laser Dermatology. We are here today with Dr. Sabrina Fabi to talk about a really important topic that's on many people's mind, and that is cellulite. Today's webinar is titled, Make Your Bottom Your Top Priority. And honestly, cellulite affects so many of us, no matter what shape or size you are. And as summer is quickly approaching, especially today, it's gorgeous outside. I think more and more people are starting to think about how they're going to look in a bathing suit and their cellulite. And the good news is that Dr. Fabi is going to showcase some dramatic new treatments that are now available at Cosmetic Laser Dermatology. And actually, some of these treatments, she and some of the doctors at CL Derm actually helped create in the first place. So very excited to hear everything that Dr. Fabi has to say and see all of her pictures. So without further ado, Dr. Fabi, take it away.
Awesome. Hi, everyone. Thank you so much for joining us. We do these because I know for many of my patients, at least, you guys are always so curious when I'm lecturing all over the world, what is it that I'm speaking about? And I know that sometimes we don't have an hour together to discuss all the nitty gritty on the science behind the procedures that we offer in the practice. And so that's why we've elected to kind of share the same educational content that we share with colleagues all over the world with you for being our loyal and established patients. And so today we're going to be talking about cellulite. A lot has evolved in this space. In fact, there have been now 2 treatments approved in just 1 year, actually 3 treatments approved in just 1 year, all of which I was a primary investigator on. So it's really exciting to be able to offer these procedures to you and to have had firsthand experience in the development of these procedures. And so we have a couple of poll questions for you. And this is so that we can kind of gauge what's bringing you to today's webinar. So if you can just participate with us, the intent here is to—
Yes. So this is anonymous, so don't be shy. Do you have cellulite? Yes or no? And be truthful. Don't make us feel bad. And what bothers you most about your body? Is it excess fat, a flat butt, a sagging butt, cellulite? And it's okay if it's all of them. Mm-hmm. So just give you guys a few more minutes to comment here. And last chance. One more person has to submit. Oh, all right, there we go. So let's share this.
And so 90% of you have cellulite, and that is actually in keeping with what all studies have ever shown. The 90% of women, for the most part women, not men, mainly because it's probably hormonally driven. Men that end up going on estrogen for prostate cancer sometimes can actually show cellulite, have been able to demonstrate that they can also have cellulite like women. So it's hormonally driven. So what bothers you the most about your body? Okay, 80% say cellulite, but the rest I saw had some concerns about a sagging butt, which we'll cover, a flat butt, which we'll cover, as well as excess fat, which we'll cover. Okay, thank you, Risa. And so it's funny, we show kind of cellulite, we'll see it in babies because of the transfer in milk to the baby from the mother of high estrogen levels. And then we'll see somebody who's extremely fit, who has this beautiful face like Sharon Stone, who's done such a great job keeping herself together. And then the back side of her just, doesn't match that front side. And so why is this happening? The thought is that cellulite is really something that's driven biologically. We see it after puberty in women, and it's because our body adapts to almost want to store fat so that ultimately you have that storage for when you have children. And that's the reason why we see a shift when we go into menopause in women from that excess fat and cellulite in the lower body to that of the abdomen once in menopause. So what can you do about it? And what's the ideal that we're striving for? And so this is the ideal, right? If you look at her waist to hip ratio, it's about a 1/3, 2/3 ratio, which is considered ideal. And we'll kind of go through what's ideal. And so then that way you can understand why, as much as we'd love this to be a one and done type of treatment for the lower body, it tends not to be, because we're going to dissect down cellulite. Somebody like this comes into the practice and they tell me that they have cellulite, but it's much more complex than that. What you're seeing here are dimples, and the dimples that you see in the butt cheek of this person can absolutely be treated with modalities that are for cellulite. But then you also see what my eyes see is laxity. And we know it's laxity because if you pull up on that skin, the rippling that you see along the outer aspect of this person's butt is no longer there. And so that is not necessarily going to be addressed by modalities that address dimples. And that's going to have to be addressed by modalities that tighten up the skin. In one study, they found that after the age of 30, pretty much anyone who has cellulite has an element of skin laxity because the skin is now getting thinner. So you can think of it getting thinner, and it's generally very adherent to the underlying muscle. And now it's kind of slipping off of that muscle as the bands that run from that skin to the muscle start to thin as well. You also see these pockets of fat. They're called saddlebags. Some people refer to them as saddlebags. This is not cellulite. This is going to be addressed by something like cool sculpting, or if it's very small and focal, even something like Kybella, which I've done a lot of off the neck treatments for small pockets of fat on the body very successfully with. And then something that happens in women is this volume loss along the outer aspect of the thigh. So you can see in her that it's almost starting to dip on the outside of the butt cheek. And this is what we call a hip dell. And this is very masculine, actually. So you'll see these very fit men, and they have this carved out like concavity along the outer aspects of their butt. And this starts to happen to women as well. So it's not just the face in women that starts to look more masculine, it's also the butt cheek. And the last thing is stretch marks. And so stretch marks aren't cellulite, and this can easily be addressed by a laser. So what's the ideal? So when I'm looking at someone, it's like, I'm not just, putting a bandage and treating one dimple and I'm kind of looking at, not just, I do this with the face all the time, but I also do it with the body. I'm respecting the silhouette that I'm treating, because if you respect the silhouette, then you can strategically pick out what treatments you're going to start with so that it's also cost effective for you as the patient. So, first, in somebody like you see on the left-hand side, you're looking for an ideal waist to hip ratio. A lot of people are doing BBLs. If you're on Instagram, you see all these crazy surgeries. I'm not the biggest fan of them because what they don't show you is how these people look 5 years later when they've gained maybe about 5 pounds, and they now, all those fat cells in their butt behind, blow up, and now like the butt can't even fit through the door, right? So it looks abnormal. And what they also don't show you is that the butt starts to sag because the ligaments that hold that butt cheek up, you got to think about it. Like it's pretty spectacular that the butt can stay up like it does. Like, look at that graph in the middle. It's suspended up. I mean, that's partly, yes, your muscle, your glutes that are holding that up, but that fat is injected sometimes over that muscle. So that can start to kind of sag. And so that's why I'm not the biggest proponent of something like that. And if you are considering a BBL, ask them to show you photos of their patients 5 to 10 years later. So when we're looking at a lower body, I'm looking at that butt in relationship to the waist. That's number one. I can do all the best things to the butt cheek, but if the waist is not, about like a 0.7 ratio, where the waist is smaller than the hip, the width of the hip, then I'm only going to make you wide. And then the butt also is about how much it projects. So in studies, the ideal projection is again 0.7. So from the anterior aspect of the abdomen to the very kind of small of the back, that's one dimension. And that should be about 70% of how far back your butt goes from your pubic bone. And so projection as well as the width. And then the last dimension, which we don't talk about a lot, is that diagonal dimension, that nice curvature that you get from this side angle that we lose and we call the hip delt, and that starts to make us look more masculine. And so, as I told you, this is ultimately what that patient looks like. What you're trying to achieve is a butt that is devoid of a lot of pigment, nice and even in color, is not hairy, because it doesn't matter if you have all these beautiful contours if the butt is hairy, and we can do laser hair removal for that, is round in its contour in all dimensions. So not just how much it comes back out, but if it goes in immediately, it's going to look like a male butt. And then one that doesn't have dimples, or that is smooth in its surface because it doesn't have rippling from skin laxity. What are your options to treat? So I generally start by reducing fat, because I've done pretty much most of the trials when it comes to laxity, whether it's with all therapy or other modalities for the lower legs and butt, whether it's with injectable Sculptra or injectable Radiesse. And I find that in studies, we find that patients don't look as great or can appreciate the result from these procedures if they still have excess fat. So if you're my patient, I'll generally recommend either cool sculpting or lipo to address that saddlebag or to address that waist to restore that beautiful ratio. Then after we've reduced that fat, I'll address the dimples. Today you can do Cellfina. Cellfina is probably the most effective modality, but it's a little more invasive. I'm going to walk us through that. You can do Quo, which was approved last March. You can do Resonic, which we just actually brought into our practice. And then the most recent technology that I was an investigator for as well is called Alleviate. That's the trade name now. It was NCA'd in the trial. These are modalities that can help release those dimples. And then for that volume loss, so once the dimples have been addressed, the butt, it looks nice and smooth, then you can address that volume loss in that hip delt that makes the butt look more manly. If you address that first, but you're covered with dimples, you're not going to appreciate the result, and it's kind of like a waste of money. You can do a fat transfer there, but I find the people that need the fat transfer are the very people that don't have fat to take from. And so for that, I like to use Sculptra. You can also use Cool Tone, which we have in the office, that can build up that muscle, whether it's the gluteus medius or the gluteus maximus muscle. And then to address the laxity, that's the last part. And that I usually either do with dilute Sculptra, dilute Radiesse, oral therapy. So let's walk through them. This is your patient. This is the patient that comes into my practice. She comes in because she feels that her butt is saggy. But it's not that the butt is saggy. It's that excess fat along the outside aspect of her butt draws the eye to make you go down. So I'm going to kind of start right back here again. It draws your eye down. So it makes all of this look bottom heavy. If she would have gone to someone and they would have done all therapy, it's not that all therapy doesn't work. It's just that it would have been the wrong treatment to start with on this patient. So we'll go through what I did with her. So I first was going to reduce that fat, what I'm going to do with her with Cool Sculpting. And then on the same day, I released those dimples. I like to use Cellfina if somebody has a lot of dimples, because a single treatment can improve those dimples, 90% of those dimples, by at least 50%. And so this is pre-pandemic. I don't have a mask on and I'm probably about 10 pounds lighter. But you can kind of see when we do Cool Sculpting, we apply all our own cups. It's not a tech. And you can see how we position you, because it's all about positioning. We have a dedicated room with a bunch of different pillows, because if you don't position properly, it'll essentially slide right off. Then that same day, I'll treat the dimples, and I treat it by first numbing. So if she has not been medicated, doesn't require medication, it's just injectable numbing. And then here you see me releasing the dimples with the little mouse. It almost looks like a computer mouse. That dimple gets sucked into a cup, and then I go in with my little mouse and I release the dimple. And that's how I do all of them. And that essentially will end up taking about 30 minutes to release the dimples, an hour for each side as I do the Cool Sculpting. Now here she is, same patient, 3 months later. And so you can see as you shift, if you reduce that fat, you shift the eye up as you release those dimples, that fat actually comes out. So she doesn't need any Sculptra or fat to build her butt cheek or to fill those hip delts. And her butt looks more lifted. So it's, again, choosing the right modalities, and that'll come from going to the right person. So let's talk about dimples. If it advances. Let's see. Okay. So the first treatment that I'm going to talk about is Cellfina. And Cellfina is a little bit more invasive. You just saw me do it. We have been doing it now in our practice since 2014. We were one of the first practices to have it in the country. In the trial that was done by other dermatologists and colleagues of ours, 90% of patients showed more than 50% improvement in their dimples at 3 months. That lasted to 1 year. And now in a long-term trial showed to 100% of those dimples were still improved at 5 years. So the stuff works and the stuff lasts. People always ask me, well, will I have more cellulite? Can I develop? Yes, you can continue to develop more cellulite. So it's not going to stop you from developing more cellulite. And that can happen if you have a massive weight fluctuation. But the dimples that were treated will be gone. And so you can see here, does she have maybe the tiniest shadow of a dimple still left? Yeah, but pretty substantial results. This is one of my patients, a single treatment 3 months later. When I mark, we put you in our photography suite, and it's important to kind of really isolate the dimples, because you want to make sure that you're treating dimples and you're not treating laxity, because the laxity is only going to get worse. And then you can see me kind of releasing those dimples. So it's actually very simple to do. The person is in no pain as I'm doing it. She's just relaxing, comfortable, takes 30 minutes. And then afterwards, she's wearing Spanx. It sounds horrible, but it's very quick. And so this is another one of my patients 2 months later. Look at how much more youthful her butt cheek looks. So it's not just dimples. When you relax those dimples, everything, all that fat is able to be released and reshape the butt to look more youthful, like those projections that I had showed you from the beginning. In a study done by some of our colleagues in New York, they found that you can actually get 674% more volume from releasing the dimples. And this is another example of one of my patients. She's a 50-year-old woman. By releasing those dimples, it's like everything came out. And so save yourself the money by starting with something like Sculptra or fat transfer. Release the dimples first, and you will see that your own fat kind of redistributes and fills in those gaps, regardless of the age. Now, for some people, that 30-minute procedure might seem a little too invasive. And that's the reason why there are other modalities that are less invasive that have come out, such as Quo. I've been an investigator for Quo since 2016 and have injected multiple patients now. I love it in my practice. It's amazing, even though it may not be as effective as Cellfina. Not everybody wants something as invasive. And here you have to undergo 3 treatments as opposed to 1.
Starting with position A.
And so let me actually turn down that volume so that, there we go. And then let me play again. Sorry, guys. Let's see if I can move this. There we go. All right. So in the clinical trial that I was involved in, we treated 800 women. There was multiple sites. We treated women up to 78 years of age. So everyone's bothered by their cellulite. Here, it's a poke. So it's just an injection. You see me injecting on the right-hand side. I actually did their training videos for them to train doctors all over the country. And so here in the trial, we did 3 treatments spaced 21 days apart. And what we found was that 64% of subjects showed improvement. So it's not maybe 90% like Cellfina, but it takes 5 minutes to do. And there's no anesthetic required, no numbing cream required, done right at the bedside. You can add it on to your Botox and your filler treatments. You can see the results on the right-hand side, maybe not as remarkable as Cellfina, but pretty significant. And I'd have to tell you that a lot of my patients are satisfied. The limitation with this trial and the reason why only 64% of people were happy or saw results was because 50% of subjects were obese that were enrolled in the trial. And so when the manufacturers decided to do a trial actually looking at patients that were within their ideal body weight, again, underwent 3 treatments. This time we treated up to only 60 years of age. What we found was 86.4% of subjects showed improvement. And so this is essentially, you're seeing me do the treatment on the right-hand side. I've timed myself. It takes no more than about 7 minutes. And I do like it for thigh because unlike Cellfina, where it's a lot of, disruption of those dimples, here it's a slower disruption. And so if you have a little bit of laxity, I might tell you to do Quo instead. But for butt dimples, I might tell you to do Cellfina. So that's where the experience of whoever's treating you and assessing you matters. So you can see my patient on the right-hand side, that thigh looks smoother after treatment. What they found was that after 3 treatments, there was at least 50% of elimination in dimples. So that's pretty significant. 50% of your dimples were gone after 3 treatments. A lot of my patients are happy. And this has made a lot of my patients happy. The most notable side effect with this procedure is that you can get bruising. So that's the reason why in our practice, we offer you a complimentary pulse dye laser to come back to and get about 2 days after your injection. And then again, about 5 days after your injection to minimize the bruising, which can ultimately leave a little bit of temporary pigment. And so these are some of the results from the trial. You can see it's more than just dimples, but the quality of skin was actually found to also be improved from this procedure. They call it biostimulation. And so I think it's pretty neat. The skin does not get thinner. It actually gets thicker and the fat redistributes, similar to what we saw with Cellfina. The newest kid on the block is Resonic. This is called rapid acoustic wave technology. And so here, a single trial that they did, 12 weeks after one treatment, they found that 93% of patients showed improvement and were satisfied. So you can kind of see the outer thigh of the subject looks a lot better after treatment. This is a single treatment in that trial. You can see here we're using, it's a more of a device and we apply it. There's no pain from the procedure. You don't have to take any medicine. The nice thing here is that there's no bruising. The bad thing here is that it can take about an hour to do, and you may need 2 treatments. I know in the trial they only did 1, but I think in practice you're going to probably need 2. In this study, they actually found that the skin got thicker. Also, you can see that's something that we kind of show histologically, like biopsies of skin showed much thicker dermis compared to before, and new collagen production. So these modalities are doing more than just dimples. They're actually helping stimulate a little bit of collagen production to improve the appearance of laxity as well. And so with that, a lot of information, I think Risa has a poll question. Risa, we can't hear you. You're on mute, love.
Oh gosh.
There you go. I was like, oh, maybe it's my.
I'm so sorry. Okay, but you guys are answering these questions. So have you ever tried to treat cellulite? Yes or no? And how successful was your cellulite treatment? Less than 25% effective, 25 to 75%, or greater than 75% effective? So let's see what you guys all think about what you have done so far. I wish these questions could have some right-in answers too, but we're stuck to multiple choice. All right, any final answers? Okay.
Okay. So about 60% have tried treating their cellulite. And actually in a survey that we did, and that is probably going to be published, where we surveyed women across the country, about 2,400, about 2/3, 66% had actually reported having tried treating their cellulite. And like those that actually tried, about 90% found that it was less than 25% effective. The majority of things that people try typically are topical creams, whether they have caffeine in them or they're retin-A creams. Those things aren't going to necessarily help with true dimples. They may cause some micro swelling that makes everything look a little bit better. The retin-A in the long term might not be a bad idea because it can thicken up the skin, but it's not going to help with the dimples. So as you've seen, a lot of the stuff that is out there that we carry here has a much greater efficacy than just 25%. So hopefully that gives you guys hope. Now, another reason why you may not have seen improvement in your cellulite when you tried treatment is because you didn't really have cellulite dimples, but there was an element of laxity. And so this is extremely important to discern the difference, because if you don't, then it's not that those cellulite dimple treatments don't work. It's just that they're not going to work for this. And so what are we talking about when we talk about laxity? And so the butt starts to kind of sag as we get older. So there's an element of butt laxity. So the butt becomes ptotic. And then also this can happen with the thighs, but we're going to start with the butt first, and then we'll move on to the thigh. And so there was a trial that was done by a group, David Goldberg, out in New York, and they were trying to measure if you can improve the lifting of the butt to improve the appearance of the butt cheek, because it starts to sag with age. And what they found was that after a single treatment with Ultherapy, when they only treated half of the cheek and left the other one untreated, that butt cheek lifted and the other one remained hanging down. And the results can last about 2 years. Unfortunately, your body starts to slow down in its ability to stimulate new collagen again. And so it needs a boost. And that's the reason why you need to do another treatment. But they were able to see a lift in that skin. And so this is an example of laxity of the butt cheek. She's very fit. She doesn't have dimples. She's getting that excess banana roll. Everything's kind of sagging. Here she is. She's 49 or 50 years of age. Here she is 6 months later. So nice and lifted. And that's buttock laxity. So the butt is lax here, not the thigh. This is another beautiful 44-year-old, has had 6 kids, extremely fit, aerobics instructor, but you can see the butt starts to kind of sag. It just becomes like almost one with the thigh, very similar to the face. It starts to sag, almost becomes one with the neck. There's a lot of parallels with the face and the neck and the butt and the thighs. And so here, after a single therapy, you just see it kind of perks up a little bit. This is an example, again, where it's laxity. Those kind of that waviness is not cellulite. Although people would say it's cellulite, it's the wrong terminology to use. And here terminology matters because then you're going to use the wrong treatment. So with her, this is laxity. She's a 60-year-old woman, extremely fit, as you can see. She doesn't have dimples. All that redundant skin is secondary to laxity. With her, I did Ultherapy, and on the same day, Sculptra. Here she is a month later, and it looks better.
Can take 1.5
and so now I'm going to lower the volume on this thing because we don't have to subject you guys to all that. But here, what I do is I typically combine Ultherapy with either dilute Radiesse or dilute Sculptra if there's an element of laxity, especially for the thighs. I just I showed you the combination on the butt with Ultherapy and Sculptra. Here on the thighs, I'll do a little bit of dilute Radiesse immediately after the Ultherapy. And the reason I do this, and for those patients of mine who are on this webinar, you know that I like to do things based on science, not just because I felt like it or like it's on a whim. There was a great study done by one of my friends who practices in Spain, Gabriela Casabona, and she found that when she just did Ultherapy versus when she did Ultherapy combined with Radiesse, she saw a significantly greater level of improvement in the skin laxity and cellulite of both the buttocks and the thighs. And so again, I just mark the area. I put little numbing dots so that you don't feel a thing. And then I just run a little cannula, and it takes me no more than 5 minutes to treat each thigh. She found significant improvement in the thickening of that collagen. So even the 70-year-old woman, you can kind of see all of that outer thighs, like that outer butt skin, that rippling that she has is so much improved from thickening it up when doing a combination of Ultherapy and dilute Radiesse. We're also now we just completed a trial looking at Sculptra for slight to moderate skin laxity of the thigh. And again, we're seeing results. They're not lasting more than a year though. And so I generally tell my patients, if we're going to use the injectable biostimulators, you're going to need to do at least a single treatment every year because your body needs that boost to signal to those cells to start churning out more collagen. So unfortunately, this stuff, it's not that the stuff doesn't work, it's just that it also doesn't last forever. And if it does work, it's not 100%. It can do a certain level of improvement. So this is from our trial. You can see just kind of a smoothening of the skin 2 months after 2 treatments of dilute Sculptra to the back of the thigh. So the way that I inject it and my concentration is different when I'm trying to use it to improve skin quality versus if I'm trying to do it to increase volume. The depth of where you put this is also going to vary if you're trying to make things more voluminous or if you're trying to improve quality of skin. And so I think we have one more question here, right, Risa?
Yes, we do. All right, everyone. So last question. This is pretty easy. Well, at least it's just one question this time. So do you think cellulite is necessarily associated with weight? I'm not exactly sure what the answer is going to be here myself, but I don't know if it's a trick question or not. We will learn. So do you all think that cellulite is necessarily associated with weight? A few more seconds. So yes, maybe, or no. All right. Last 2 seconds. 3, 2, 1. Okay. All right, here we go.
Okay. So that's ooh, 1 second, Risa. It's telling me that something's wrong with my computer. Hello?
Hey, no worries. Okay, we can still see your screen.
Okay. Yeah, that it's cooling down. My computer to cool down. Okay, so this is a great question. Because what we see is that even women that are extremely fit, they actually do it for a profession to, be fitness instructors, they can even have cellulite. I think it's actually probably more associated with being a female and hormones, as we've seen in men that are, for whatever reason, having their testosterone blocked, than because of weight. Can weight make it worse? It can. And so if you gain 5 pounds, will that fat be stored in your outer thighs and butt? It will. So the second thing that probably contributes to it the most is a great deal of weight fluctuation. So if you gain and lose, that's probably the second. If you can just stay steady in your weight, probably less likely to show the signs of cellulite, whether it's dimples as well as laxity, because that skin is getting stretched. So when you lose that weight again, it gets a little loose, and then it can demonstrate laxity. So the 20% that said maybe, that's probably the most accurate. There's an element of weight, but I've seen extremely thin people have cellulite. So I guess the biggest point to this question is losing weight is not necessarily going to make it go away. And is that the last question we had, Risa?
Yes, it is.
Okay. All right. And so now we go to volume loss. As we get older, we're also losing our ability to build muscle. There are modalities like magnetic muscle stimulation. You guys may have heard of M-Sculpt, or cool tone. These things allow us to build that muscle that we no longer have the capacity to build like we used to. And that to a certain degree can build the butt cheek. So, but we reach a point, no matter how many squats or lunges that we're doing, we just can't build that butt like we used to. And the butt is extremely important because, as I told you, it contributes to those ideals, those proportional ideals with our waist, and those proportional ideals when it comes to the side view of a person. And those proportional ideals when we compare a male's butt to a female's butt. So there was an interesting study here that was done by Neil Sadik. He's a friend and colleague in New York, where they took 17 patients and they treated them 1 to 3 treatments. Even one made a difference. I'm going to show you some of my patients. And 80 to 100% had some level of improvement in their butt cheeks. So you can see with him, by putting that along that hip dowel that starts to dip in this patient, she looks a lot better and everything looks a little bit more taut. These are some of my patients. So this is a relatively young person, but her butt is starting to look flat. And no matter how many squats she does, her muscle capacity to build and project can only do so much. She doesn't have the fat to take to inject and give her a BBL. So what can you do in those cases? You can do injectable Sculptra. And so just one session, I did 3 vials on each cheek. Here she is 3 months later, and she was very happy with the results. It gave her the nice projection she wanted. Her clothes looked better for her. There are doctors up in Beverly Hills that are injecting like 20 vials of Sculptra. I discourage that in one session in one area. If you want to sprinkle it all over the body, fine. But if you're putting it all in one area, what I tell people is that Sculptra relies on your body's ability to stimulate new fat, if you're injecting it in the fat plane, or new collagen, if you're injecting it immediately under the dermis. And so it's relying on the body. You can only make the body do so much. So if you do too much in one session, the body reaches a cap or max on what it can do. And so it's almost a waste. You're not getting a return on that investment. So I generally keep to 3 vials per cheek in a session. And then maybe I'll do another vial in a different area, or multiple vials in different areas. But in one area, I won't do more than 3 vials for volumetric change purposes. I'd rather you come back and we do multiple sessions than do multiple vials. This is an example in a 47-year-old. Again, she felt like her butt was saggy. You can see she's super thin, doesn't have a drop of cellulite, but just doesn't have that muscle mass to keep her butt cheek up, nor the fat to keep her butt cheek up. With one session of Ultherapy to kind of lift that butt cheek, the ligaments that hold that butt cheek up, think of it like a pulley. And then one session of Sculptra, again, 3 vials per cheek, you can see that on the right-hand side, she has a much more youthful backside. And so it went from like a 40-year-old butt cheek to almost like a 20-year-old butt cheek. And so with that, I hope that's been a thorough review of all that is possible. We're going to open it up to questions because that's kind of the goal, is to have an open dialogue, and hopefully you've walked away today learning something new. Thank you so much for your attention.
Thank you so much, Dr. Fabi. That was great. And the pictures, I mean, are really worth 1,000 words. It's so impressive. I would challenge anyone to try and find that good of before and afters online of cellulite. It's incredible. So please go ahead. Any questions you have, you can submit them to the chat or to the Q&A function in here. And if it's okay, Dr. Fabi, I'm going to stop your sharing so we can see you a little bit bigger.
Okay.
And let's get to it. So here's the first question, which is a good one. How do these treatments work on the abdomen?
So for the abdomen, dimples are not, I would not treat anything that's dimple related on the abdomen. You're not going to get those results. And many of these products have not been tested on the abdomen for dimples. Usually what we're seeing on the abdomen is laxity, in which case I usually will do Ultherapy, very similar to what I talked about for the laxity of the lower of the buttock and thighs. And depending on whether it's severe or not, I might do also injectable Sculptra or dilute Radiesse. If it's mild, I might even just do alone some Sculptra. So it depends on the severity, but we definitely have biostimulators as well as energy-based devices that can address it.
Okay. Here's another one. Is there any way for me to prevent getting cellulite or prevent it from getting worse?
If it's true cellulite dimples, as I mentioned, I think that minimizing significant fluctuations of weight. There's a plastic surgeon in Vienna who's going to be doing a session that I'm teaching worldwide on cellulite next Saturday. And he just sent us his pre-recorded talk, and he's an expert on cellulite as well. And what he has found in looking and logging all his patients is that the people that end up having the worst cellulite have self-reported that they had a significant weight fluctuation. So it's even if they're thin now, they went through a weight fluctuation. So it's avoiding those weight fluctuations that are greater than 5 pounds. Sorry, guys. I'm included in
that. All right. What would be the best cellulite treatment for us 66-year-olds?
With 66-year-olds, you saw, I showed you one of my 6-year-olds and one of my 70-year-olds. If you have true dimples, I would do Cellfina. If you have a lot of dimples, and if you have deeper dimples. But if you have more laxity, then generally, I mean, I have to assess the person, right? All 66 doesn't look the same. Like you saw that beautiful 60-something-year-old, she had no dimples. And with her, gestalt therapy and Sculptra did great.
Interesting. All right, great. So if someone is interested in getting some body contouring done at the same time as a cellulite treatment, can they do both?
Yes. So as you saw, I did a little bit of cool sculpting, and then the same day I did the cellulite dimple treatment. You can do Quo, you can do Resonic, you can do Cellfina. So you can do both on the same day.
Understand. Is Quo better than Cellfina? That's a tough question.
In the trials, they did not show that 90% of dimples improved by 50%. So that was, they did not show very similar metrics in the trial. When you optimized for laxity and optimized for age, it did better. It was more like about 80%, but it's not at 90 like Cellfina.
All right. And to know if I truly have cellulite or something else, who do I need to go see?
You need to see one of us here at Derm.
Yes. Board certified dermatologist. Is there any age you feel is too young for a cellulite treatment?
I haven't had to treat anyone that's less than 25 years of age.
Got it. And how about some of these more Eastern techniques of medicine, or of treatments for cellulites, like cupping or grapeseed extract? Do you have any thoughts about any of those?
I actually did a pretty thorough review of what's available topically. And honestly, topically, the only thing that really showed something meaningful was Retin-A in the long term. And that's because it addresses the thickening of the skin and the laxity component of cellulite. The cupping is going to cause some micro swelling. So if you're trying to maybe make it look good temporarily, but you're also taking the risk of bruising if you do cupping. So no, it's not a long-term solution, and it's not approved for the treatment of cellulite.
Got it. And how many treatments does someone need with cellulite before seeing those results you showed?
It depends on how severe your cellulite is. With Cellfina, you'll see results after a single treatment. It just matters how severe were your dimples and how many did you have to begin with. We may consider a second one. With Quo, again, I generally tell my patients that even after 2, they'll start to see something. But again, how severe, how deep were the dimples and how many did one have will dictate how many treatment one needs.
Absolutely. And do you sometimes combine these different treatment modalities together?
Yes. So we come up with a treatment plan. And so that's why assessment is, coming in for a consultation is the most appropriate thing, because I'll determine how much laxity you have. And then we'll plan from the beginning that we can get this much improvement but you might need all therapy afterward, or you might need some dilute Sculptra or Radiesse afterward, depending on what you come in with.
And that's why CL-Derm is such a great option for this, because since we have every modality, Dr. Fabi can pick the best one for you, as opposed to most practices probably only have one option, if even that, for cellulite. So, all right. Well, I think we've made it through all of the questions. So any final words from you, Dr. Fabi, for those of us out there struggling with cellulite?
Yeah, don't be hard on yourself. 90% or more than 90% of women have it. So we can't, no body shaming about it. It's almost like accept it, right? Mm-hmm. And you get to do something about it. We get to do these treatments. I guess, reframing the way that we look at it. There shouldn't be any shame about it. Mostly everyone has it. And you can do something about it. What a blessing. And we're getting better at, the results that we can achieve from these modalities. I wouldn't waste so much money on snake oil and things that claim they can do things. There are things that actually have shown to improve it for the long term. And so that's really important. And come in for a consult, and then you can learn more if you qualify for some of these treatments.
That is great. So again, the first 5 people who mention this webinar and book a consultation with Dr. Fabi and book their cellulite treatment with Dr. Fabi will get this free elastin reform and repair complex, which is great. And Dr. Fabi is, not only does she lecture all over the world, but she is booked out pretty far. So if you're thinking about it or possibly interested, I absolutely encourage you to call and get on her schedule sooner rather than later. We do have 6 other board certified dermatologists at CL-Derm, and all of them are also, trained to treat cellulite as well. But definitely get in sooner rather than later. Dr. Fabi is hard to get on her schedule these days.
And they'll put you on a wait list if I know that I'm booked until the end of June, but they'll put you on a wait list, and the wait list does work. People end up, they do call. So don't feel discouraged.
Absolutely. And someone's asking if it's going to be posted online so you can view it again, this webinar. Absolutely. This whole thing was recorded. We will be sending this out this weekend, and it will be on our website and social media. So I encourage you to share it and review it, and, better understanding what your options are for cellulite. So thank you so much, Dr. Fabi, for your time. Thank you to everyone that tuned in, and don't forget to call and schedule your consultation with Dr. Fabi or any of our dermatologists to treat your cellulite.
Thank you, guys. Have a beautiful evening, and thank you, Risa, for hosting this meeting. Bye, guys.